Good evening and welcome to another edition of Ask the Specialists here on CMU Public Television. Tonight, we ask the eye doctors. Welcome back, and thank you for joining us tonight. We want to answer as many of your questions as we can, so give us a call, 800-727-9268. You can see the number right there on the screen in just a minute or two. That's 800-727-9268. We take questions via Twitter as well, WCMU_AskThe, and via Facebook, facebook.com/AskTheSpecialist. And we're joined by a couple of specialists in the field of caring for your eyes. We welcome in Dr. Erin Miller. Thank you for joining us, Doctor of Optometry at the EyeSight here in Mount Pleasant.
Thank you.
And I guess I'll start and use a real-world example. It's been about 2 years since my last eye exam, and I'll come forward and tell you that Dr. Miller is actually my doctor. And what's the benefit of actually having that yearly exam? Let's talk about the importance of that.
Well, we want to make sure that we're looking for preventative things that maybe patients don't have symptoms of. Glaucoma, for instance, is a routine thing that we check on an annual basis, and just other general things like looking for cataracts, macular degeneration, and of course, for a younger person, checking their prescription, things like that on an annual basis as well, which can change from year to year. So
very good. Folks, do as she says, not as I do. I'll be making my appointment very soon.
Thank you.
Dr. John O'Grady joins us as well, specializing in comprehensive ophthalmology, cataract surgery, refractive surgery, and glaucoma. Joining us from the Great Lakes Eye Institutes. You practice out of Saginaw and Alma.
Correct.
And the GLEI also has locations in Midland, Cass City, and Frankenmuth. We appreciate having you join us. And we spoke earlier about refractive surgery. I was curious what that was, and if you could describe it for me.
Refractive surgery is different methods on how to get out of spectacles or contact lenses, most commonly known as LASIK. There are other different refractive surgeries, surface lasers, epi-LASIK, LASEK, but they're all different methods of changing the shape of the cornea, which is the front part of the clear front part of the eye,
Sure.
to improve your vision, to try to get out of glasses.
All right, very good. Something that maybe a lot of folks out there would enjoy if they had the opportunity, certainly. We already have our first question in, and we look to Sparta with our first question. They note that they have dry macular degeneration. What is the usual time limit before becoming blind, they ask? I've been followed for this diagnosis. They've dealt with this diagnosis now for some 2 years. Dr. Miller?
Well, macular degeneration can have a varied prognosis for different patients. Some patients have a very slow progression of their macular degeneration, and other patients have a more rapid change in their vision and their macular degeneration. So it's hard to predict for any one particular patient what their particular prognosis is going to be, or the speed at which they may experience change in vision or vision loss. So the best way to stay on top of that is very close follow-up with their eye care professional that's monitoring their macular degeneration to make sure that any sudden changes in vision gets followed quickly. So.
Sure. And they specified dry. Are there variants?
Yes, so dry macular degeneration is the most common form of macular degeneration. About 90% of patients who have macular degeneration have the dry form. About 10% of patients have the wet form, and the wet form of macular degeneration unfortunately tends to be the most aggressive form of macular degeneration and can cause the most severe vision impairment in the shortest period of time.
Okay, very good. Dr. O'Grady, we have a couple of questions on cataracts. First, what causes them?
Well, cataracts, first of all, everyone, if you live long enough, you get cataracts. A cataract is the lens of your eye. Everyone has a lens in their eye, and it just gets cloudy with age or with different other mechanisms. Sometimes medications like prednisone, trauma can cause a clouding of that lens. So the cataract is just the clouding of the lens.
And that's going to happen to anybody if you live long enough?
Yes, yes. Okay. The lens just gets more cloudy the longer you live. So
right,
eventually everyone gets them. And basically when they become bad enough and they affect your vision, then we can take them out.
All right. And again, a question from Facebook. You can follow us there, facebook.com/AskTheSpecialists. Do you know of any drops or supplements that are effective to treat cataracts?
Nothing that's really proven. I mean, there's a lot of research going on, looking at different medications to try to slow the progression of cataracts, but basically, it's just a natural part of aging.
All right. For Dr. Miller, could you explain for us the symptoms of a torn retina or detached retina? Caller from Alpena today.
So the symptoms of a torn or detached retina would include possible flashes of light in their vision, usually in their peripheral vision, a sudden onset of floaters, spots, squiggles, dots, all of a sudden in their vision, or a curtain or veil coming over the vision in any direction. Those would be symptoms of a retinal tear or detachment and should be addressed within the same day, within the same 24-hour period.
Really? Okay.
When those symptoms are first noticed.
And you talk about floaters tied to that, but some might experience that just in general, that little thing, and as you try to focus on it, it sort of drifts out of your view.
That's right.
What is that? What causes that?
So floaters are caused from a breakdown of the vitreous, which is the jelly substance in the back of the eye, and that's a normal part of the aging process as well. And so some floaters are very normal, but if you experience a sudden change in floaters, new ones, or you're just not sure, the best thing is to go get a dilated eye exam on the first onset of those symptoms to get it checked out.
All right, very good. Dr. O'Grady, a question again about cataracts. They want to know, when can you have them removed? A caller from Alpena.
Well, when patients come in and they have cataracts, basically it comes down to their symptoms. If they're not bothered and they're getting along, reading fine, driving, seeing their street signs, television, and they don't have any problems, then I tend to wait until they become worse. When they become symptomatic and they're not able to do those things, that's when we talk about taking them out.
Okay, very good. Dr. Miller, a caller from Petoskey, they note that they have a swollen bottom eyelid, which continues to keep happening. The eye continues to water, and the nose runs because of this. Doctors don't know why this is happening. Might you have any ideas?
Well, a swollen lid could be a variety of different things. If there's a bump associated with that swelling, it could be a stye or a chalazion, which is an inflamed or infected oil gland of the eyelid. But there's a lot of different reasons why a person may have swelling. There could be some infection. If the person has already been checked by other doctors and it's been an ongoing investigation, that might just need to be further pursued if it's been a problem. So. All
right, very good. Dr. O'Grady, folks are really concerned and interested about cataracts tonight. Caller from Reed City noting that they had cataract surgery about a week ago. The doctor says that he has pressure on both, and I shouldn't quote he, I'm not certain about that, but the doctor says that this person has pressure on both eyes now. What does this mean, and how long does this last? Is pressure a concern?
Well, everyone has a certain amount of pressure in their eyes. It's when it becomes too high, when it can be a problem. Sometimes after cataract surgery, due to inflammation, the pressure can temporarily be elevated. So I'm sure that his or her doctor is watching that closely. But if the pressure was already high or it stays high, that can be a condition we call glaucoma, which is a disease of high pressure in the eye that causes damage to the optic nerve.
Okay.
But it can be just temporary after cataract surgery.
All right, very good. A caller from Bear Lake, they say that they have had blood vessels break in both eyes on the same day. What might have caused this? Dr. Miller?
Blood vessels breaking in both eyes on the same day sometimes is related to maybe exertion, heavy lifting, coughing, sneezing. Those kinds of things might cause broken blood vessels on the white part of the eye, and that's not unusual. Other times, patients who are on blood thinners like aspirin or Coumadin or other medications that may act as a blood thinner, we may see those kinds of things happen more frequently. So.
All right, and I'm going to follow up with you because we actually had a question come from Traverse City asking about one-a-day aspirin and its effects on macular disease. And I just heard that in the news today, a study noting that maybe there's a tie between aspirin use and macular degeneration. I don't know what you have to say on that.
I don't have any information about that. Maybe Dr. O'Grady has some information about that.
There was recent studies linking the two, but it's not proven for sure. It's not a direct link.
Just sort of an introductory study.
Yeah,
something
what I tell my patients, they've been asking me about this, is talk to your family doctor, or internist, you know, because taking aspirin is very important sometimes if you have heart disease, things like that. So we have to just watch the eye, and then the internist makes the call whether they want to continue aspirin or not. But there is a link, but it's not proven 100% yet.
Something just to be aware of, and okay.
Right.
Very good. A question from Barryton. They note that they're a 60-year-old male, and they note that when they read, their eyes start burning. He says, I wear bifocals and use eye drops. He notes Opti-Free. When the burning happens, do you know what this what causes this, and could this be dry eye syndrome? Dr. Miller?
So burning is a very common symptom of dry eye, and so that can sometimes be treated with over-the-counter artificial tears. It sounds like he's already been trying that. Other times it's related to chronically clogged oil glands. That's another issue that can sometimes be a problem, and we may handle that with a variety of different treatments, such as warm compresses, massage on the eyelids, along with cleansing the eyelids with baby shampoo or some other eyelid cleanser. So, yeah.
Okay. All right, thank you. Caller from Maryland, noting that they've been having some double vision and they have had cataract surgery. Is there another reason for that? Do cataracts cause double vision, and what's the issue potentially here?
No, the double vision would be unrelated to cataract surgery. When you see double, what's happening is the eyes aren't working together. Usually the eyes are focused both together, and you see with stereo vision. When one eye is not lined up with the other, that's when you tend to see double. So that would be unrelated to the cataract surgery. Sometimes it's a paralysis of a muscle, something like that.
Okay.
They'd have to get it further evaluated, but it has nothing to do with the cataracts.
All right. So go see your doctor.
Right.
All right. Question from Mayo, noting after 55 years, I don't know what that is referencing, but they say, has there been any more research on lazy eye? Dr. Miller?
Well, lazy...
Or what can be done for lazy eye today?
So lazy eye usually occurs because of an eye turn possibly that happened since birth, or a large difference in one's prescription from birth, and so that eye just never develops the same as the other eye because it does not get the same input from the other eye to form those strong connections with the brain. And so the lazy eye will develop depending on the cause of it. Is it a muscle problem? Is it a prescription or deprivation problem? There's vision therapy, or in some cases surgery, muscle surgery, if that's the issue, that can help straighten the eyes and potentially improve the lazy eye to be more attentive. So. Okay,
thank you. A couple of questions tied to diabetes. One from Manistee, they ask, can diabetes cause sight loss? So that's A. And then from Saginaw, if you are a borderline diabetic and take aspirin, does it quicken blindness in the eyes? Dr. O'Grady?
Well, diabetes definitely can cause eye problems. It's one of the leading causes of blindness in the world. It can cause loss of vision in a variety of different ways. Most commonly, it affects the blood vessels in the eye and the retina. Specifically, you can have swelling in the retina, bleeding in the retina, detached retina, scarring from the detachments or the bleeds. So it's very important that any diabetic have a yearly dilated examination. Being on aspirin does not increase that risk, however.
Okay.
So.
All right, thank you. Speaking of retinal tears, you just sort of mentioned it there. Caller from Plymouth, they want to know what percentage of retinal tears might heal themselves, and does this happen? Dr. Miller?
I don't know an exact percentage of how many tears would heal themselves, but that is a pretty unlikely situation. I have seen some small holes, small tears or detachments that have been long-standing. I've seen some scarring around them, but it is very unlikely that would happen. I'd say it's a very small percentage, and any symptoms need to be evaluated very quickly by an eye doctor.
All right, thank you. A question from Gaylord about peripheral vision. This gentleman wants to know what can be done to prevent losing peripheral vision.
Well, the most common cause of losing peripheral vision would be glaucoma. You can also lose some peripheral vision from having a stroke or different problems in the brain, but glaucoma is probably the most common cause of loss of peripheral vision. Unfortunately, glaucoma is a silent disease. You don't know you have it. You don't feel eye pressure. By the way, glaucoma is a disease where you have high pressure in the eye. So again, the best thing to do is to be evaluated by an eye doctor, have what's called a visual field that maps out your field of vision to see if there is any peripheral vision loss, and if there is, they can figure out what's causing it.
Okay. We'll return to some tears in the eye, Dr. Miller. I've had a tear in my macula and now have a hole there. Will this heal? And we've talked about that. Maybe that's not so likely. Will this heal on its own, or is there something that can be done about it? Is there anything to improve?
So a macular hole there's again a variety of different prognosis for a macular hole. In some cases, the macular hole can improve over time on its own. Other times it can remain the same, and sometimes it does get worse and cause blurred vision centrally, and the hole can be repaired with surgical procedures if the vision is bad enough, and the surgical intervention is warranted. Then your eye doctor will make recommendations about that. Okay,
thank you. Dr. O'Grady, a caller from Custer asking about cataracts. Do they clear up, and do cataracts move? This person notes that they wake up in the morning and things are fine. They can see okay, but it gets worse as the day progresses.
Well, that's probably not the cataracts that's causing the fluctuation, because the cataract, again, is the lens of the eye getting cloudy, and that doesn't fluctuate during the day unless they're diabetic. If they're diabetic and their sugar fluctuates, that can change things. But if they have a fluctuating in vision, it's probably not the cataract. It could be something else like dry eye. Dry eyes tend to get worse as the day goes on. Or again, if they're diabetic, that can make things fluctuate.
Okay, very good. Caller from Tustin for Dr. Miller has macular degeneration. This caller has that and is always squinting. What can be done for this? I don't know if they're specifically asking for the macular degeneration, or maybe the squinting is what's more problematic to them.
So, perhaps the person just needs something as simple as a change in their glasses prescription. But if that's not the case, then, the macular degeneration, it could be a sign that the macular degeneration is getting worse. And so there are, I don't know how severe the person's vision loss is, but there's low vision devices, which are types of magnifiers and special things for patients who have very severe vision loss. There's lots of resources available for patients with low vision.
Okay, thank you. Dr. O'Grady, it is the hot topic of the night. We have a person actually with the dual effect here of both glaucoma and cataracts. If she removes the cataracts, will the glaucoma worsen?
No. Sometimes when you have cataract surgery, you get inflammation in the eye and the pressure can rise temporarily, but usually it comes back down to normal levels, as long as if they're on drops for glaucoma, for instance, they have to continue those. But the surgery itself doesn't tend to worsen the glaucoma. If someone has very severe glaucoma and they're on multiple eye drops for it and they have cataract surgery, usually we do a combined cataract glaucoma surgery to try to correct both problems in the same surgical setting.
Okay, and sort of a follow-up here too. I think we touched on this, but let's cover it again for folks in Reed City here asking, after cataract surgery, I have quote-unquote swelling behind the eye and don't know what this means. Is there anything that can be done about this? And again, is this that pressure that you're talking about that can develop a little bit after surgery?
No, what they're probably talking about is sometimes due to inflammation. If someone has weak blood vessels, say they have high blood pressure, diabetes, and the wall of their blood vessels is a little weak, sometimes fluid can seep out of the blood vessel and cause swelling in the retina. And usually we treat that with eye drops temporarily. If eye drops don't work after a few weeks and they still have swelling, then we can inject some steroids behind the eye or around the eye to try to dry that swelling.
Okay, very good. A caller from Elmira for Dr. Miller. It seems sometimes I have migraines in my eyes. It doesn't hurt, but I see flashes and lose peripheral vision. Is there anything to prevent this or to help it, and what might that be?
So, and that's a very common thing with patients who experience migraines, is to get visual aura or ocular migraines. They may see flashes of light, colored kaleidoscope type looking things, or a whirling, blurring to their vision or temporary loss of vision. That tends to last anywhere between 15 to 30 minutes and is sometimes followed by a headache, but not always. The biggest concern of mine is that anytime somebody has peripheral vision loss or flashes of light, unless you've been through it a few times and it's been confirmed by an eye doctor, it's important to get those symptoms checked out by an eye doctor at least the first time or two to just confirm that it's not a more serious condition like a retinal tear or detachment or a stroke in the eye.
And I think that might be a good place for this person in Petoskey as well. They ask, can anything be done about floaters? These have progressively been getting worse for this person. I think you were talking about that earlier, how if you see a change,
right,
you need to have an eye exam. And you mentioned specifically having the eyes dilated, was it?
Absolutely. So if you have a sudden change or a worsening of floaters, that's always indicated to get a dilated eye exam to make sure that there's not a more serious problem going on rather than just normal age-related type of floaters.
Okay. Dr. O'Grady, we've heard from Grand Haven tonight. They ask, is LASIK surgery bad? Or can you use LASIK surgery for a bad astigmatism? Does it work for astigmatism?
Yes, it definitely corrects astigmatism, corrects nearsightedness, farsightedness. However, if the astigmatism is irregular, and the way we can tell that, we do different mapping of the cornea to see if the astigmatism is treatable, or if it's irregular, for instance, due to scarring or diseases such as keratoconus, those are not, it's not recommended to have LASIK. So if it's, even if it's severe astigmatism, if it's regular and treatable, we can fix it. But if it's irregular, then it should not have LASIK.
What kind of recovery period is there after LASIK surgery, just in general?
Well, with LASIK, what LASIK is, we create a flap in the cornea. The flap is opened, we do the laser, and then the flap is laid back down. So the advantage of that flap is they're basically back to work driving the next day. So most people see excellent immediately following LASIK.
All right, very good. Dr. Miller, a question from Royal Oak. If a person has shingles in their eye, that sounds painful already, what are the chances for permanent damage? Can that affect the eye that detrimentally?
Yes, having the shingles in the eye, which is of course the chickenpox virus, if you do have that affect your cornea, it can lead to severe vision impairment. So again, it needs to be evaluated by an eye doctor as soon as possible to minimize the amount of scarring that might cause some permanent vision loss.
Okay. Why do our eyes water in the cold? A good question for a day like today. Caller from Saginaw.
Most commonly, it's the eye is dry. If you're out in the cold, it's probably windy, and the eye may be dry to begin with, or the wind itself might dry the eye. So that's the most common reason the eyes water is the cornea gets dry, and then the tear gland, reflex of the tear gland is to water more, so then the eye waters.
Okay, very good. So you know why as you're out and about tonight. For folks in Rapid City, this gentleman says, my wife has synesthesia. What exactly is it, and is that pronounced correctly? Is this synesthesia? Is that something you're familiar with?
No.
All right.
I don't know that term.
We'll move on. Apologies, folks in Rapid City. Hope you're doing all right there. In Guthrie Lakes, this person says, I have clouded vision in my eye, and doctors have told me that if it moves, they'll have to see me again. What does this mean? Is this a cataract we're talking about? Or is this something different? Clouded vision.
It could very well be a cataract. It could be many things. You know, the eye could have a cataract. They could have some problems in the retina. They could have hemorrhage in the back of the eye or macular degeneration. So the best thing, obviously, is to get it checked right away if they have blurry vision. All
right. Caller from Ann Arbor, a 62-year-old male who has good vision, but woke up with blurred vision and a stinging pain in just one of his eyes. What could this be? Just sort of out of the blue like that. Dr. Miller?
Again, any sudden change in vision or pain should be evaluated the same day by an eye care specialist. So it could be a variety of different things, but I would want that checked out as soon as possible.
Okay. A question from Traverse City. At what age do the occurrences of CSR stop happening, if they ever do? And my question is, first, what is CSR? And we can go on further with that for our folks in Traverse City.
CSR is a disease called central serous retinopathy. And it's a swelling you get in the retina near the center of the vision, near the macula. And it's more common in nearsighted patients, more common in males, although females and farsighted patients can get it, but those two risk factors seem to stick out as males who are nearsighted. And it tends to happen between the ages of 20 and 50, but it can continue to occur. But usually we see it start dwindling after, after the age of 50.
Okay. Caller from Thomas Township, they note that they have and this drives you crazy when it happens, the twitch in the eye, that little tick. Dr. Miller, what causes that?
So twitching around the eye or eyelid is most commonly caused by stress or caffeine intake.
Okay.
Those are the two big things. Stress could be just environmental stress, and occasionally can be eye strain type related stress as well. So.
All right, very good. What happens, Dr. O'Grady, when you're on the computer and then you sort of see double or ghost vision? What causes this to happen? You've strained your eyes maybe as you're watching. What's causing that?
Most commonly that is dry eye syndrome. As one tends to look at a computer for hours, you kind of override that blinking reflex, so you don't blink as much as you ordinarily would, so the eyes tend to dry out. It can also be an eye strain, muscle strain, which you may need to have your eye muscles evaluated, but most commonly it's just dry eyes. So using artificial tears while you're on the computer would help.
We just have a moment left. Quickly, for folks, and cataracts has been the hot topic tonight, a question from Mount Pleasant. Do you know of any supplements and or eye drops that can help?
No.
So it's surgery once it gets bad enough.
Right.
All right, very good. Folks, we had a number of questions, and I want you to direct you to our Facebook page. We'll try to get a couple more answered for you this evening. You can find that at facebook.com/askthespecialists. We want to thank you for all of your questions tonight, and our special guest here as well, Drs. Aaron Miller and John O'Grady, for your expertise tonight and for braving the elements. We appreciate you making your way out on a snowy night here in Central Michigan. Folks, have yourself a great evening, and join us next week for Ask the Specialists here on CMU Public TV.